Please welcome to the stage, Nick Desai, founder and CEO, Hey Renee.
Hi, everybody. Good morning, and I've enjoyed the panels this morning, and thank you to Hint and Zach for putting together such a great conference, and everyone here at RealWorks, of course. It's phenomenal, and the breakfast was great, too. We've been talking this morning about some of the tactics and some of the specific business models and questions and operational challenges and opportunities in direct primary care. I want to talk a little bit more about the why. Like, why are we talking about this, right? We already spent $4 trillion of healthcare on healthcare in America. Why are we talking about new models of healthcare? Why is this such an important discussion, and why is it so timely? And at the onset, before getting into any of my slides, I want to say that one of the things that when people hear direct primary care, outside of the people like us and the people in the industry who think about this all day, people think concierge care, people think expensive care, people think, well, that's for rich people, or more options for people who already have great options, right? My fundamental belief when we built Hey Renee over the last year, and in the 8 years previous, my wife and I built a company called Heal, many of you have probably heard of, home-centric primary care and doctor house calls. Our philosophy has been that healthcare is a fundamental human right, and that we need to make sure that great healthcare is available to everybody. And I wouldn't be here speaking to you today if I didn't think that direct primary care was a more effective way to get healthcare to lower income and socioeconomically disadvantaged people than most of the traditional current alternatives. And so with that, we'll get to my slides. Are you seeing my slides? They're here. Okay, good, cool. Okay, awesome. So the numbers in healthcare tell a very depressing story. And there are some stats on the screen, and I'm going to come back to those, but the most important one I want to say is this. If you look at total healthcare spending, and this is in inflation-adjusted real dollars, we're spending 10 times as much as we were 50 years ago. And that would be good. That would be justifiable, because what's the point of a society if we're not improving quality and life expectancy? If we were improving quality and life expectancy. Well, between 1970 and 1990, we did improve life expectancy. Healthcare costs went up by about 2.5 times in real dollars, and we improved life expectancy by roughly 10 years. That's the most significant increase in life expectancy in that period of time in recorded history, right? That's amazing. But since about 1990, 1995, year 2000 to now, life expectancy has remained flat, and healthcare costs have quadrupled. So we're just not getting more for our money. Now, where is all that money going? That's a great question. Well, in general, when there's a lot more money, either and consumers are paying more for healthcare than ever before, which they are, which I'll get into. Generally, the supply side is happy, right? A great example right now is the cost of gasoline. We're all paying more, and oil companies are making record profits, okay? Generally, that's the way a market economy works. I'm not saying oil companies should make record profits, but I'm saying that we have a system where the overall spending is spending more, the government is spending more, individuals are spending more, despite the fact out-of-pocket healthcare spending has doubled, inflation adjusted, despite the fact that out-of-pocket healthcare spending accounts for far less of total healthcare spending now than it did 50 years ago. Here's where it's all going, to total waste. In the last 25 years, between 1990 and 2015, in that 25-year period, the number of doctors practicing medicine in America as a percentage of the population increased 0%, okay, per capita doctors. The number of people working in healthcare administration, bureaucracy, and billing increased in that same time period 5,500%. That's where the money is going. And Over the last decade, almost $250 billion has been invested in companies that are supposed to make platforms and portals and digital health and all these cool things that are supposed to have had some impact on it. And all that's done is that costs are rising at a faster pace than ever before, and care is harder to get than ever before. And doctors are making less money. And when you think about that stat, that in inflation-adjusted dollars, doctor salaries have gone down by 40%. And that's real money. Think about this. There weren't a lot of jobs 50 years ago, other than being a doctor, that paid six figures after going through school or professional school. Today, I could send my kids to a 2-year college to learn coding, have a job for a couple of years, and by the time they're 23 years old, they're making 200 grand. I have software engineers. When we were running Heal, we had 300 doctors working for us, and we had software engineers who were 22 making more than doctors who were 52 years old, right? And they spent a lot more time in school. And just as an aside, my wife would never allow my kids to go to anything but a 4-year college. I just want to put that out there because she'll listen to this. And the numbers for doctors are worse than just economics. Doctors are spending only 27% of their time practicing medicine and over 2/3 of their time on bureaucracy and healthcare administration. And part of what is depressing to doctors is that they make less money, but much bigger is that they're not getting to practice great patient care. They don't get to do most people that go into primary care by now have figured out, I'm not going to become really rich doing this. I'm going to have a decent life. I'm going to have some debt. I'm going to be in school for a long time, right? All of those things, but at least I'm going to save people's lives. And then you get in and you become a paperwork pusher and a collections agent chasing down the $3.47 of out-of-pocket costs that some patient didn't pay. 50% of all Americans with bad credit have bad credit because of unpaid medical bills of $200 or less. 54% of doctors feel significant stress, and doctors have the highest suicide rate of any profession in America. Think about that. Our healers are sick, and they're sick because of a system in which they're trapped. Now, what we did at Heal, and I'm not plugging the company, but I want to talk about this, is we wanted to deliver doctor house calls. And we wanted to do it in network with insurance. And we were like, is this even possible? Will this even work? Well, when we started this in 2014 and 2015, people are like, you have to do a concierge, it's never going to work. I was literally on a stage at a VC pitch contest, and 5 VCs, and we were voted the winner, and we won 100 grand, and that was kind of cool. But all 5 said, you're going to have to charge way more and make this a concierge service. Well, 8 years later, the company's still around doing extremely well, and we don't charge more. Because what we did is we didn't charge the patient more, and we didn't ask for more from the insurance company. We cut out the bureaucracy. What we did is use real-time eligibility verification, and hey, you could go book your appointment on an app, which I think most people would love over sitting on hold at a doctor's office. 70% of doctor's appointments are still made by waiting on hold. We did that, and it turns out we could enable our doctors to see 10 patients instead of 40 patients a day, spend more time with each patient. Doctors were happier, patients were happier, outcomes improved, and we did this at in-network insurance rates. That company has gone on to raise $250 million of investment capital, seen almost 500,000 patients, operates in 11 states, and I mention that only because it can work, okay? And it's in that context that I met Zach and Hint and I absolutely fell in love with what they're doing, because enabling, now, direct primary care can leverage the promise of digital health, right? We all hear about digital health, and great, you know what? If I have insurance, I can go sign up for a prescription delivery app and a mental health app and a diabetes app and a hypertension app and a portal to track my medical records. And I could name 2 or 3 other things, except we're not diabetics or hypertensives or people who need prescriptions or people who need telehealth. We're one person, a 68-year-old woman named Juanita Gomez, who has diabetes and hypertension, doesn't drive, but is working part-time and also takes care of her grandkids, right? Unless we understand the context of that real person, we're not able to deliver great care. And if you've seen the market caps in digital health, they've cratered. All the public companies are down approximately 90%. Companies like Teladoc and all these big companies are down. Why are they down? Because health tech isn't a modality and human beings don't live in verticals. We're not a disease. We're a person that has a lot of context and importance. But the good news is there are tons and tons of vertical solutions that do really interesting things. And if direct primary care was the genesis of stitching those things together, that could be a really great way to deliver care. And doctors, this is the thing I emphasize more than anything else. Doctors have to be at the bedrock of the solution. They have to be at the foundation point of the solution. We can't build companies despite doctors. And so many health tech companies have done that, from the pill mills to the telehealth startups, to just more and more commoditized doctors. And today, the largest employers of doctors in America are the largest health systems and insurance companies in America. And to me, that is a massive conflict of interest, because the people who are trying to make sure that you use healthcare less are employing the people who want to give you great healthcare, right? The other big trend that has happened over the last decade that is extremely important is that healthcare happens better at home. Now, over the last 2 years of the pandemic, we've all become used to everything happening at home. Grubhub brings food to my house, and Netflix brings movies to my house, and blah, 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 and blah, 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 and blah, blah, blah. And that's great. And most of the time, what you get at your house is a equal or slightly worse experience, right? Grubhub is great or seamless. It brings food to my house, but it's still in a box, and I still got to use a plate, and I still got to throw stuff away. It's not waiter service, and if they didn't put the extra cheese on my food, then I don't get the extra cheese, and if they didn't pack the chili, whatever, right? And as we've seen with Top Gun Maverick, right, there's a theater experience that's hard to replicate on my iPad at home. Healthcare at home is actually fundamentally better healthcare, because home is the only place where you can assess social determinants of health, and social determinants of health determine 80% of health outcomes. You can't tell someone to take a medication with milk if they can't afford the milk. And they are too embarrassed to tell you that, or they don't have the health or tech literacy to tell you that, okay? And it's easy for us in Denver or in Los Angeles, where I live, to think about, well, doctors are available and doctors are this. 80% of this country lives in areas that are doctor deserts, that it's actually really hard to get a doctor because of bureaucratic reasons or geographic reasons. You're waiting between 2 weeks and 2 months to see a doctor. And what that does is it forces everyone, and especially lower income people, to make imperfect, more costly healthcare choices. So we believe that the private practice, first of all, we have to get doctors back to private practice, because corporate-owned medicine is bad. Corporate-owned medicine is conflicted. Corporate-owned medicine is why doctors are burning out, why you're paying more, why wait times are longer, why half of medications are not actually taken by patients, and why chronic disease are 90% of the 40 million chronic kidney disease patients in America will move on to dialysis. That will end up costing $14 trillion that we have no idea how to pay for. We're not helping people get better, we're just managing care. In fact, it's called managed care for a reason. We have to liberate doctors to practice medicine, and the way we do that is what we believe is hybrid omnimodal lifestyle care. So a lot of talk about work from home right now, and people want to work from home, and a lot of you probably work from home. I have 3 young kids, and I don't want to work from home, but that's a separate conversation, because I don't want apple juice on my keyboard. But many people want to work from home. Guess what? Doctors can't work from home, but they want to, and they went to a lot of school. And if you create a private practice that's built around the doctor and enabling the doctor, and you understand that you can send the doctor into the home and their community-based medicine, and they can see a patient in their home maybe once a year and assess the social determinants, but they themselves can deliver a majority of the care beyond that once a year visit from the privacy of their own home via video, because they already know the social determinants. They already know the context of the patient. They've already seen the patient's home environment, and they can directly speak to that. And when the patient needs urgent care or telehealth, they're not talking to some rando, okay? They're talking to their doctor, right? They can leverage market forces, and people talk about market forces like they're a bad thing, but market forces in the American economy have enabled ruthless efficiency. In the way goods and services and food, everything has to be efficient for it to work if market forces are applied. Market forces do not mean that the patient should be responsible for the entire cost. Medicare can be responsible for the cost. The state government can be responsible for cost. The employer can be responsible for the cost, but it doesn't mean that there has to be a large bureaucratic infrastructure in the middle. What it means is that patients should get the care they need with the efficiency of market forces applied. One of the panels before me was talking about pharmacy, and people would rather pay the $450 than the $250 with the insurance because the cost of the insurance versus the number of medications they use. There's another important part of that, is that when you pay the $450 and when you feel like you're buying something, you become the customer and you're going to demand the kind of efficiency that we expect from pizza delivery. Last night I ordered pizza to my room, and it was 3 minutes late, and I got 6 texts apologizing from the Grubhub and the this and the 10% off and the whatever, okay? That doesn't happen in healthcare. We can enable horizontal whole person health because great software tools, shameless plug, we happen to make that at Hey Renee, can work with that doctor who's building a new ground up practice that is built around the doctor and the patient relationship to do all the stuff that happens when you're not seeing your doctor. The 8,756 hours a year that you live without a doctor in your house, not me because I married my doctor, but most people live without a doctor, is a time where most care happens because the medication you don't take doesn't do anything for you. The tests you don't get done, the preventive health checkup you don't do. You can have monthly subscriptions paid by employers, insurers, or the government. The most efficient healthcare system in the United States from a payment model perspective, the most efficient payer in the United States is Medicare. Only 2% of their costs go to healthcare administration. And to think that we can't change the way Medicare thinks about this is wrong. When we built HEAL, Medicare had a regulation that prohibited house calls to all but 2% of the Medicare patients who are considered medically homebound. We went and met with Seema Verma, who was head of CMS. We played the Indian card. My wife and I are both Indian. We got a meeting with her, and it worked. And 22 meetings and trips to Baltimore, which sound like a lot, but it really wasn't because they have this great crab in Baltimore. But anyways, 22 meeting trips to Baltimore later, Medicare actually changed the rules so that January 1, 2019, sort of right before the pandemic, as it happened to happen, because no one knew in January that there was going to be a pandemic, Medicare changed the rule to allow doctor house calls to every single person over 65. And when Medicare changes, guess what? The private insurance companies follow. And self-insured employers are already looking at this. And there was a slide that somehow got missed here about health equity, which I want to really quickly talk about, which is lower income minority and women patients spend more out of pocket than affluent people, men and people in big cities. And the reason is they're on Medicaid. My nanny, who's on Medicaid, wants to see a doctor, and through her Medicaid, the doctor wait for her is 6 weeks in Los Angeles, California. Now, my wife's able to see her because she's a doctor and whatever, but the point is, it's 6 weeks. So what would she normally do? She would go to an urgent care that isn't covered by Medicaid and spend the money out of pocket. Or she'd ignore the issue until it became a much bigger issue and we'd all spend a lot more money, right? 52% of families and 22% of all out-of-pocket expenses are for doctors. So why not turn that into an efficient market-based system? So our fundamental view is that a direct primary care model that sits around and is built around the doctor-patient relationship that includes hybrid virtual care and a subscription-based payment model can cut through the Byzantine quagmire that is the U.S. healthcare system. And direct modalities should allow employers, insurance companies, and the government to pick up the tab so it's available to everybody. And the last thing we learned, and what I will say, is don't lack courage as you create your new model or your new company. In healthcare, to change anything, you have to change everything. Thank you very much.